Hey, Emily. Can they see the screen? All right, thank you. All right, so before the class starts, so I'm going to China pretty soon, and I have some like small jade decoration that I need to give away. Looks like this. So if you come to class on Friday, I'll just give you one for free. I think there should be enough for everyone in the class if everyone comes to class. So I think I have at least 40 of them, including RTA. So if you want one, come to the class on Friday and I'll give it to you. Okay, so today we are gonna keep talking about abnormal behavior and disorders. So for this agenda, we're gonna review what abnormal behavior, and then we're gonna talk about how can we explain those behavior, and then we're gonna use DSM-5 to talk about the categories of psychological disorders. Did I tell you what the DSM-5 stands for? So that's like the Bible for clinical psychologists. They use this manual to match the patient's symptoms. So if they match the symptoms on the manuals, they will be diagnosed with certain disorders. So yeah, it's just like the current version manual that clinical psychologists use. Okay. So using the APA criteria, when we try to describe an abnormal behavior, we have distressing. So we will say that the behavior is maladaptive and the behavior is causing personal distress or harm to the person, him or herself, or to others. The second criteria is dysfunctional. So when we say if the behavior is dysfunctional, it means that it interferes with ability to function and adapt to stresses and demands of everyday life. The third criteria will be disturbance. So the behavior has disruptive changes in a person's behavior, thoughts, or feelings for the worse. So if the person is having changes towards the positive side, we wouldn't call that behavior is disturbance. Then lastly, the behavior needs to be deviant. So it means that the behavior is unjustifiable. So we cannot have an identifiable or reasonable external cause to explain the behavior. So that would be deviant. So those are just some general criteria when we talk about abnormal behavior. However, we'll need to use the DSM-5 to look at the symptoms to make a diagnosis. Any questions on this part?
Can you give an example of
deviant? So for no reason, this person decided to buy 100 books from the bookstore, and you ask them, why did you do it? They cannot really tell you the reason. Right. Yes. You don't have to meet all of the criteria to say a behavior is abnormal. So those are just some guidelines, very general guidelines to help us to spot the abnormal behavior. If that makes sense. All right. Okay, so how do we explain abnormality? We used to have this supernatural model. Some people still believe in this today. So they explained abnormal behavior using the possessions by gods or demons. So this happens in a lot of the ancient culture or in a lot of the cultures nowadays in different areas of the world. Okay. And next we have biopsychosocial model. And this model suggests that mental disorders are caused by interactions of biological, psychological, and social cultural factors. I will give you some examples on the next slide. Okay, so biological factors, those include your physical illness, your destruction of bodily processes, or your genetic influences. Psychological factors include your wants, your needs, your emotions, your unconscious conflicts, maybe your early relationships with your parents, with your caregiver, based on your past learning experiences and your current situations. Social cultural factors include your gender, your age, your race, ethnicity, or something like your marital status, cultural values, physical, social, economic situations. Okay. So that model will suggest they all interact with each other. And if something goes wrong in each factor, you might exhibit abnormal behaviors. And next, we have the diathesis stress model. According to this model, mental disorders are the results of an interaction between a predispositional vulnerability and stress caused by life experiences. So it's a combination of those. So diathesis means a predisposition for psychological disorder. And I'll give you some examples for this. So based on this model, disorder is caused by your diathesis, such as your genes, plus stressors in life, such as your workload. Right? So for precursors, we have a lot of precursors, such as your genetic factors, your brain disease, early learning experiences, or your bad family dynamics. With those precursors, plus your diathesis, which is your vulnerability, and plus stress, such as your social stress from school, from work, and your stressful family life, or your poor self-understanding, that will lead to disorder, especially mental disorders. So that's the diathesis stress model. Any questions? Yeah. Yep. Okay. You don't have any questions before? We have a lot to cover today. So here, let's do a practice question. When Rebecca's aunt was suffering from bipolar disorders, Rebecca thought the best course of action was prescription drugs. Rebecca believes in what cause of mental illness? You guys agree? Okay, very good. So it's biological because she believes that you can use drugs to treat mental disorders. Okay, so that was how people explain disorders or abnormal behavior. Next, we're going to talk about different psychological disorders one by one. So first, we are going to talk about anxiety disorders. So this is the most common type. It affects around 18% of the US population. The average onset age for anxiety disorders is about 11 years old. Have you seen the meme, keep calm or something? If you do have anxiety disorder, it just won't work for them, right? For the characteristics of anxiety disorders include the anxiety can be excessive or unrealistic. It could be long-lasting. It disrupts your daily function. And you have maladaptive behavior to reduce anxiety. So this is not the anxiety itself, but how do you cope with anxiety? Maybe you use avoidance, you try to avoid a lot of stimulus, maybe avoid people, avoid doing something, and maybe you try to cope with anger. Some people even have substance abuse. So those will be maladaptive coping behavior. And those will be the characteristics of anxiety disorders. So we have different types of anxiety disorders. First, we have phobia. So this is when you have an irrational, persistent fear of an object or situation. So under the phobia criteria, we have specific phobia. That's when you have fear of specific stimuli or situation, such as height, snakes, clown, etc. The second type will be social phobia. Sometimes we also call this the social anxiety disorder. That's the fear of being criticized or embarrassed, especially in crowds. So they have trouble with communicating and public speaking. Then we also have agoraphobia. That's the fear of situations where escape could be difficult and help may not be available. Some examples will be in crowded areas, bridges, public transport, or even the ocean, right? So those are different types of phobia. When people are afraid of heights or they're afraid of snake or clown with a reason, we don't usually categorize that as phobia. And if their response is not very extreme or irrational. Sometimes if you're afraid of heights, you might think, oh, I might have this acrophobia, but maybe you're just afraid of heights. Does that make sense? So it's not malfunction. So it doesn't really affect your life. Right, so there are some different types of phobia. We have acrophobia, that's afraid of heights. Claustrophobia, afraid of very narrow or small spaces. This is the chorophobia, afraid of clowns. Gamophobia, afraid of marriage. don't want to get married. And then this one's funny. The consectoteleophobia is the fear of chopsticks. And this actually is very strange. Okay, so those are some examples of phobias. Next, we have the panic disorder. This is the second type of anxiety disorder. When you have panic disorder, you have recurrent, terrifying panic attacks. And you have this feeling of losing control. Some symptoms for panic disorders or panic attack include heart palpitation, pressure or pain in chest, dizziness, sweating, and faintness. Do you know what heart palpitation means? No, it's skipping a beat. Yeah, irregular or skipping a beat. Or maybe you add a beat. So irregular. Okay. So panic attacks seem to occur without warnings or cause. So it can happen anytime. And people's worry about future attack may restrict normal activities. So some people, they are panicked about having panic attacks. So they're worried that when's my next panic attack is going to happen, and that triggers their panic attack. It's like a vicious cycle. Right. The third type of anxiety disorder is the generalized anxiety disorder. So this is when people don't have a specific cause. They just feel anxious all the time. So this is long lasting, and it's unspecified anxiety for at least 6 months. Some symptoms for the generalized anxiety disorder include irritability, sleep problems, inability to concentrate for a long period of time. And this is more common in women. Do you have any questions regarding the 3 types of anxiety disorders that we just talked about? No? Yeah.
So someone kind of like panic attack, is there like something like work or I guess work or stress over things? Is that
so it's really that they can identify the specific cause. If it's just stress, that's normal. So stress can come from any type of situations, right? Stress can come from worrying about having attacked, and stress can come from workloads, even family members, family gatherings, right? So it's really that you have a stimulus and then you know that triggers your panic attack. If you have a stimulus and then you're so afraid that your behavior is starting to be maladaptive, that's more like phobia. Does that make sense? Good question. All right. Any other questions or thoughts? Anxiety disorder? No. Do you know anyone who said that they have anxiety disorders, or they say something sometimes like I have panic attacks, stuff like that? No? I think I heard that before, like some people say, oh, I just had a panic attack or something. But I don't think, for a lot of times, they're not using it correctly or accurately. It's not really a panic attack. It's just like a surprise, or the last time I scared you. It's not like a panic attack, right? But some people might describe, oh, you just made me have a panic attack. So misusing those terms sometimes can be harmful or stigmatized for the people people who really have the panic attack. So try to use the terms correctly. Yes. All right. The causes for anxiety disorders include biological. So anxiety disorders, all three types, run in family. It's shown in twin studies, sibling studies. Doesn't matter if you are reared apart or together. If you share that genes, you're more likely to have anxiety disorders in the family. And then nervous system oversensitive to stress, that could cause anxiety disorder as well. However, that's a little harder to test or examine using experiments. Right? So it's more like a theory or educated guess. Okay? And then we have the psychological cause. That will be your environmental stress. This is pretty straightforward, right? It's pretty easy to understand. Your environment can create a lot of stress. I'm sure you guys know and experience this, especially in college, right? Yep. And then for psychological causes, also include irrational thinking. Some examples will be the all or nothing thinking. So you can think this is never going to happen, or it always happens. There's nothing in between. Very extreme. If you have those kind of thinking patterns, it might create your stress or increase your stress. Overgeneralization. So if this happened once, you're going to think that, oh, this is going to happen every single time. Or if you fail on a test, you're going to think that, oh, because I'm stupid. I'm just dumb. So you're overgeneralizing. Does that make sense? Okay. And then magnification. Man, that's hard to pronounce. Magnification. So that's when the person is focusing on their failures. And the opposite will be minimization. This is when they ignore their successes. A lot of times when people ask, a person says that, what have you achieved? If the person says, I achieved nothing, my life is failure, that's the minimization and magnification is playing a role here. Okay, another cause is from the biopsychosocial perspective. And this assumes that biological, cognitive, and social cultural factors combine and interact. So people may have a genetic disposition, but the disorder does not develop unless the right environmental trigger occurs. So they might have like a genetic influences, or they have family issues, but they really need a trigger or a stressor to trigger that. And so that's from the biopsychosocial perspective. All right. Any questions about the causes of anxiety disorder? Good. Okay, so practice question. Hugh experiences periods of intense anxiety where his heart starts to race and he begins to sweat. He can never tell when, where, or why this happens. And so worries that it will happen again. Hugh has been diagnosed with, you think it's A? Oh, sorry. B? C? D? Okay. Very good. So it should be a panic disorder. So you don't know when it's going to happen. And you might worry about the next panic attack. Okay, very good. Right. So next we're going to talk about OCD, obsessive compulsive disorders. So this is characterized by one or both, the obsessions or compulsions. Obsessions means that you have persistent, upsetting thoughts that cause distress. And then compulsion means that you have ritualistic repetitive behavior in an attempt to reduce their anxiety. Some symptoms include that you cannot disengage attention from obsession. So you keep thinking about it. You cannot like switch your attention to something else. If you want to wash your hands, you will keep wanting to wash your hands, maybe 10, 20 times. Even if your skins are falling off, you still want to wash your hands. So one example will be body dysmorphic disorder. I don't know if this is real. This is still like a myth. I don't know if he's having the disorder that it's melatonin, right? Yeah. Yeah, or it's because he wanted to become pale or white, and then he performed surgeries. We still don't know. Okay. At least I don't know. Do you guys know? You think that's a theory, right? Some people say that's a disease. Some people claim no, that's not. It's
more types, like there's people of the like their dark skin and
yeah. Yeah.
But it was just a like not exactly but like an extreme thing.
Yeah, but for those cases, they also when they lose melatonin, their hair becomes white too. So I don't know if he had like makeups or yeah, in hair. I don't know. So that could be a body dysmorphic disorder, but this one is definitely one. Anaxasia. How do you pronounce that? And anorexia. Yeah. It could be because of this. Because when they see themselves as fat, doesn't matter in reality how skinny they are. They will see themselves as fat, and then they will not eat. They will not want to eat. Another example would be hoarding disorder. You just keep gathering stuff and you cannot throw them away. So that will be 2 examples for OCD disorders. All right. Have you heard of people using OCD to describe themselves? Yeah. What have you heard before? If they're really plain.
Don't actually have them, or most of the time don't have them. They'll say something like, "Oh, when I like write my name, I have to make it look pretty." Like that's not. Or like my room isn't clean. Like your room's so clean, be able to do your that.
Like if you tidy your room a lot, clean your room a lot, people might say that you have OCD, or you say that you have OCD because of that. So that's not accurate. Again, that would be a misuse of the psychological term. And again, that's not good.
Also, like you just figure out things. I would go, but no, I just figure.
I haven't heard of that one, but it's possible. Okay. All right. So after learning those definition or the criteria to diagnose different disorders, you will know not to use them in just random situations, right? Or you can educate your friends not to use them in those terms, because this kind of downplays the severity of the symptoms, right? When a person really had that disorder, if people don't know what that means, they might downplay that. They might be like, "Oh, you fine." Fine. I'm gonna mute it. All right. So that's OCD symptoms examples. Oh, there's another one. Trichotillomania disorder. That's hair pulling. Have you seen that before? Have you heard?
I've heard of that.
Some people might take their eyelashes. They keep pulling them. So yeah, that would be OCD. Okay, the causes for OCD is that they observe a high activity in frontal lobe or the anterior cingulate cortex or the amygdala secret. So we don't really know if this is a cause or the effect, right? Because you have OCD, that's why you have high activity over there, or is it because you have high activity in those areas and then you have OCD? So we don't really know. That's just they claiming to be the cause, but in my opinion, that's more like a correlation than cause. All right, so that was OCD. Any questions? Okay. Next, we have mood disorders. And first, we're going to talk about the depressive disorder. So depression can be a normal response to loss. Right? We all, well, most people, I would say they experienced depression before. So this is a psychological hibernation. So it's a time to slow down, evaluate, or redirect energy. For example, when you experience loss of friends, loss of family members, or if you do bad in school, you might experience depression. And that is adaptive, right? You need that. It kind of helps you. That's depression. You look confused. So when you're so sad, you need some time to slow down, right? Otherwise, you might engage in other behavior, such as harming others. Like you need to direct that energy out. Okay. And then you can use the time to reevaluate your relationship or your current status. Like, what do you need to do after this? Depression. So you associate depression with negative terms, right? So that's not really true. So depression is like a more severe term for sadness, right? But it's still an adaptive status.
So it's like the bad depression we all think of is when this happens and the person does not slow down.
I think you're thinking about depressive disorder.
Yeah.
Okay. Right. So depression is not the same as depressive disorder. So when you have depression because of a reasonable cause, that's fine. That's adaptive. However, the major depressive disorder, this is maladaptive. Maybe that's what you were thinking. So again, those are some terms that people use or misuse in daily life. So, oh, I have a depression, and you just assume that's bad. That's not good. Sometimes people need that. So for depressive disorders, this is when they always accompanied by negative cognition. So when you have depressive disorders, this is a must-have. For example, I have no control over my life, so nothing I do matters. That's a very negative cognition of thoughts a person can have. And depressive disorders, they are often comorbid with anxiety disorder and or substance abuse. So it's very likely that the person have one and the other. So the diagnosed rates are increasing for depressive disorders, especially in young people. And the suicidal rates are just increasing in a lot of countries. Japan, US, in China. So this is a very serious topic. We found that there's more depressive disorder diagnosed in the Western society than the Eastern society. You want to take a guess why? Social media You want to elaborate on that? Okay, because of social media, you have a lot of comparisons upwards, and then you feel like you're miserable. Okay, maybe, yeah.
I think it's like what we talked about, where the the Western culture for individual, like everyone wants to be different, and then you see the differences. But in Eastern, it's more like which one you like the same.
Okay. I don't really know how that connects to like if you want to be unique or you want to be common, but that reminds me of another characteristic is that people are more independent here, and people in Eastern culture they are more interdependent, so they have more social support. If that makes sense, that could be a reason. Another reason is very simple: they are more psychologists here, so people are more diagnosed. They have better medical conditions, I guess, and you can seek help. You have resources to get diagnosis, not in Eastern society. Yeah. Can be. Yeah, it can be because of OCD. It can be because of being anxious. So, uh-huh. So they might compare themselves to others, but I don't think that's because of the independent mindset, if that makes sense. Okay, cool. Good questions. Good questions. So you know there's a culture differences in depressive disorders. And we know that women's risk is doubled that of men's. Want to take a guess why? Okay, so you said that it's more socially accepted for women to ask for help or express their emotions.
So they're more like
Okay, so yep. Okay, so you said there's a higher suicide rate for men than women. That's correct.
Oh, yeah, I guess, are they more like reach out to others? Like about, want to talk about? I know at least in Western society, probably 10 or 20 years ago, yeah, it's probably less so now, but a lot of people care about, gender expectations.
Mm-hmm.
I think there are a lot of expectations that not men to have.
Mm-hmm.
And I know these things have gone away a little bit. I'm not sure how that.
Okay, so are you saying that men are more likely to commit suicide? It's kind of counterintuitive that women are more diagnosed.
Yeah.
Okay, so it actually, they're both true, and you can actually explain that. So women, they're more likely to seek help, or when women go to counseling, they go to a psychologist, when they get diagnosed, they're more likely to get help, right? They're more likely to get diagnosed and they're more likely to get help. That's why maybe men are more likely to commit suicide because they don't get help. Another reason is that men are just biologically or culturally influenced to channel their negative emotions using anger than depression. Does it make sense? Okay. So some people might disagree with that, especially nowadays. If you're very, very liberal and then you don't believe in those like gender differences, you might argue, no, that's not true, but it's true. I don't think that you can already argue with that. It's just that men channels their negative emotions different than women. That's why men are more likely to commit to crimes as well, right? patterns of violent behavior. And also that relates to how men and women deal with frustration differently. So men are more likely to solve problems using violence, and then women are more likely to use gossip, or how do you ruin the other person's reputation, if that makes sense? Because women are less likely to engage in violence. It could be a cultural factors, or it could be biological factors. It's just there are differences between men and women. And that explains a lot of the society phenomena. Why are men more likely to be in prison than women? Because violent behavior leads to crime, but if you're just gossiping, it doesn't really cause any crimes, right? Okay, so those are some interesting topics. I have about 10 minutes. All right, so that's depressive disorders. So for major depressive disorders, it's the experience for no rational reason of persistent depressed mood, feelings of worthlessness, and diminished interest or pleasure in most activities. Right, so that's major depressive disorder. To diagnose major depressive disorders, you need to have 5 or more of the following, and they must present for at least 2 weeks. And you need to have at least one of the symptoms for 1 or 2. So 1 is depressed mood. 2 is diminished interest in most activities. So you need to have at least one or the other to be diagnosed. Now, other symptoms include appetite disturbances, sleep disturbances, feelings of restlessness, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think or concentrate, and then recurrent thoughts of death or suicide attempts. You don't need to have all of them. You just need to have 5 or more of those symptoms, and then for at least 2 weeks. All right, so that's how we diagnose major depressive disorder. And then next we have the persistent depressive disorder. This is longer lasting but less severe than the major depressive disorder. The diagnosis criteria is that you have depressed mood for 2 or more years. Yep. So you will have appetite disturbances, sleep disturbances, fatigue or loss of energy, low self-esteem, or diminished ability to concentrate or make decisions, and the feelings of hopelessness. So very similar to major depressive disorders. They just last longer, but less severe. If you notice, there's no the thoughts of committing suicide. Right? So here is the differences. For major depressive disorder, it's shorter, but you are more depressed. The persistent depressive disorder is longer, but less severe. Okay? So you're just constantly in bad mood, kind of like that. Okay. All right, next we have bipolar disorders. So this is when you alternate between 2 poles of emotional extremes, positive and negative. When you have a manic episode, you need to have a week or more to be diagnosed. Some examples include inflated self-esteem, so you're super confident. You have decreased need for sleep. You're more talkative. You have flight of idea. And you have increased distractibility, so you can't focus. And then increase in goal-directed activity, excessive involvement in high-risk pleasurable activity such as gambling or parachuting, stuff like that. So you're more risky taking, if that makes sense. There are different types of bipolar disorder. Bipolar 1 is when you have cycle between depression and mania. Bipolar 2 is when you have cycle between depression and hypomania. So hypomania is when you have less severe of mania and you have 4 or more days of mania. So hypo is under. You know that. And last type of bipolar disorder is cyclothymia. This is when you have cycle between less severe manic and depressed states. So using brain scan like PET, it shows that the brain activity rises and falls with emotional switches. So when a person is experiencing the depressed state, your brain activity slows down. It's not activated. But when you have manic states, everything lights up. And then it goes back to depressed states again. Yes.
Where the changes in like taking mood and how like not concept, but like how often would they change? How long would you like ask for it to count or by before?
We don't have like a very specific timeline, but if you go to the DSM-5, it will show you. Yep. I think DSM-5 is free. You can get that from the school library if you want. It's huge. Okay, the cause for bipolar disorder includes biological cause, so your genetics, your neurotransmitter deficiency. So we know that serotonin, norepinephrine, and dopamine, they are correlated with our happiness. So if you have dysregulation on those, you might have bipolar disorders. Psychological causes include distorted thinking and learned helplessness. Bethesda's stress model suggests that stressful life experiences may trigger episodes or onsets. So a lot of theories are overlapping among the disorders. If you can remember now, it's fine. You can just go back and read them through. You'll see a lot of overlaps. Okay. And next we have the dissociative disorders. This is a break in memory, consciousness, or identity. And you have the inability to recall important personal information. And it's too extensive to be explained by ordinary forgetfulness. It's just not usually when we say we forget something. Dissociative amnesia is the sudden memory loss. And this can occur with or without fugue. So fugue means the loss of awareness of identity. So the people who experience this may wander around and their person identity might be abandoned. Oh, sorry there. And then dissociative identity disorder is the reports having more than one identity. This was used to be called multiple personality identity. No, multiple personality disorder. Now it's called dissociative identity disorder. All right, that's one example for dissociative amnesia. I think I mentioned that before, right? Sure. Example. Okay. All right. The causes for dissociative disorders include psychodynamic, so repressing threats. Cognitive and behavioral causes include thought avoidance and attention. And then biological causes such as brain activity differences. Right. We don't have much time, but if you have a question, we can do that after class. So before we end the class, we're going to do a practice question. Where am I? What is my name? Daisy wakes up very confused. She can't remember anything about herself, but she does wake up in the same bed she has been sleeping in for years. What dissociative disorders is she experiencing? Amnesia? You guys agree? Okay, very good. So it's either B or C. The other two, I made it up. Right? Again, I tell you, if you see something that you're not familiar with, don't choose that. So it's not about identity, so it's about forgetting, so amnesia. Pretty good, B. All right. I can answer your questions, but you guys are good to go if you don't have any questions. For Friday, again, just to remind you, I'll give out the little jade decoration if you want it.
There's an old
No, so Alzheimer's is more age related or brain damages. Yep. Hey.
Thank you.
Thank you guys.